Mental health experts say there are a variety of factors when it comes to high suicide rates in rural areas. Just a few include the stigma surrounding mental health, access to mental health resources, ready access to firearms, and what mental health experts call the rugged mentality, which is the idea that you don't need to seek help or treatment.
We see these as risk factors in rural areas, and so we think, okay, well, what can we do about that?
Dr. Clarissa Richardson has been studying mental health in Idaho's rural communities for years, working toward solutions to bring rural suicide rates down.
The research says you need to do community-based work. You need to get the community involved in the process.
That community-based work means much of her research has centered around educating rural communities about mental health.
There's something special about rural communities in that they tend to be there for each other. But what individuals within rural communities also struggle is that they don't know how to help. Even if they did want to help somebody who was struggling, is they don't know how.
The community-based programs act as a valuable tool, especially in areas where there aren't many mental health resources.
These have included programs from mental health first aid to QPR, which is a suicide prevention program. And we work directly within the community to have them implement these programs.
The programs center around mental health warning signs and what to do if you see them.
Mental health first aid teaches people how to understand what a mental health issue is and how to empathically respond with understanding to somebody who's struggling, so that that connection can actually decrease the risk of suicide.
The University of Idaho is working to expand this research program so it becomes statewide. In Twin Falls, Natasha Williams, Idaho News 6.